When do doctors recommend a repeat liver biopsy for diagnosis? Imagine you have a liver condition that needs careful monitoring. Sometimes, a single liver biopsy isn't enough to tell the full story. Doctors often recommend a repeat biopsy to get a clearer picture of how your liver is doing over time. This is especially true when they need to see if the disease is getting worse or if treatment is working. In cases of chronic liver diseases like hepatitis C, doctors usually wait at least 4 to 5 years before considering another biopsy. This interval helps them detect meaningful changes in liver scarring or fibrosis. Doing a biopsy too soon might not show significant differences because liver changes happen gradually. So, if your disease is mild, waiting several years makes sense to see real progress or deterioration. Doctors also suggest a repeat biopsy if non-invasive tests, like imaging scans or blood tests that estimate liver scarring, give conflicting or unclear results. For example, if a blood test suggests your liver is improving but imaging shows signs of worsening, a biopsy can help clarify the situation. It's also recommended when a patient's clinical condition suddenly worsens, such as developing liver failure symptoms unexpectedly, even if previous tests were stable. Another important reason for a repeat biopsy is to guide treatment decisions. If your doctor is considering starting or changing antiviral therapy or other treatments, they may want updated tissue information. This helps them decide whether to proceed or adjust the plan based on the current state of your liver. In liver cancer diagnosis, a biopsy can confirm the presence of cancer cells. Sometimes, if initial biopsies are inconclusive or if there's suspicion of tumor changes, a repeat biopsy might be necessary. However, it's less common solely for cancer diagnosis unless there's uncertainty about the tumor's nature or characteristics. It's crucial that the biopsy sample is of good quality. Experts recommend that the tissue sample be at least 20 millimeters long with enough portal tracts, which are small structures in the liver tissue. This ensures the results are accurate and representative of your liver's condition. Because biopsies are invasive and carry some risks, doctors often turn to non-invasive options first. Techniques like elastography or blood tests that measure fibrosis are safer and can be repeated more easily. They are useful for ongoing monitoring, but sometimes they can't replace the detailed information a biopsy provides. When non-invasive tests are inconclusive, or when precise tissue analysis is needed, a repeat biopsy becomes the best choice. In summary, doctors recommend a repeat liver biopsy mainly when it will influence your treatment plan or when they need to assess disease progression after several years. The timing depends on your specific condition, how fast your disease is progressing, and whether other tests give conflicting information. Always remember, the decision is personalized, and your healthcare provider will consider all these factors to determine the best approach for you. If you're unsure or have concerns, it's best to discuss them directly with your doctor, who can provide guidance tailored to your health needs.